Hello, Chapter 1 is an introduction to the ICD9 classification system. ICD9 has been used in the United States since 1979. The coding system is used to report diagnoses, injuries, and inpatient procedures. The ICD9 is a closed classification system. A classification system is an arrangement of elements into groups according to established criteria. These elements refer to diseases, injuries, surgeries, and procedures. The groups are the most common basis of classification for medical statistical use. It is a closed classification system because it provides one and only one place to classify each condition and each procedure. Revised and new codes are developed annually and are implemented on October 1st of each year. In the fiscal year 2005, it was introduced that the new codes may be implemented twice a year, on April 1st and October 1st, to stay current with terminology and technology used for procedures. However, since this change was introduced, it has never been used. This means new and revised codes have only been introduced and implemented in October. Since October 2011, ICD9 has had a code freeze. This means no new codes have been added in preparation for the transition to ICD-10 ICD9 consists of 3 volumes. Volume 1 and 2 have been modified to facilitate precise coding of clinical diagnoses. Volume 3 is used only in the United States as a classification system for coding operations and procedures. The ICD9 coding book is also available with just volumes 1 and 2. This format is commonly used in non-acute care settings, such as a nursing home, hospice, physician offices, and ambulatory care surgery centers. Remember, ambulatory care surgery centers, even though they perform procedures and operations, must report using CPT and HCPCS codes. There are 3-digit categories that are used in Volume 1s and 2s, but the codes have been expanded to 4 and 5 digits to provide greater specificity. 2-digit categories are used in Volume 3, but the codes have also been expanded to 3 and 4 digits for greater specificity. Each code can be collapsed back into a category. So, diagnoses codes can consist of 3 digits, 4 digits, or 5 digits. Procedure codes consist of 3 or 4 digits. Volume 1 is the tabular list of diseases and injuries, consisting of 17 chapters. Half of these chapters are conditions that affect a specific body system, while the remaining classify a condition based on its etiology. There are 2 supplemental classifications within the tabular index. V codes, as in Victor, are factors influencing health status and contact with health services. And the E codes is the classification of external causes of injuries and poisonings. Volume 2 consists of the alphabetical index of diseases and injuries. It includes 2 tables for systematic arrangements of subterms under the main terms hypertension and neoplasm. These tables help simplify access to complex combinations of subterms, and we will cover them in great detail later on. Section 2 of Volume 2 includes the table of drugs and chemicals, such as displayed here. Again, we will cover this later on. Going back and discussing about Volume 3, Volume 3 contains both the alphabetical index and the tabular list for surgery and procedures. The format for the tabular list is the same as that for Volume 1, except the procedure codes consist of 2 digits, followed by a decimal point, and then 1 or 2 additional digits. Format and alphabetization rules for the alphabetical index are the same as those followed by Volume 2. One thing you will notice is that SOAP terms beginning with the words as, by, and for sometimes immediately follow the main term or subterm rather than appearing in the usual alphabetical sequence. Otherwise, the words with or without remain in the first position. Now, one thing to note, it does make a little bit of adjustment here. Volume 1 and Volume 2 of the diagnoses component of ICD9 CM, you would almost expect that the alphabetical index would be considered Volume 1 because we have all learned that you always go to the alphabetical index first. I can't give you an explanation as to why that's different. It's just the way it is, and one of those things that as coders we need to be aware of and learn to work with. The tabular list of Volume 1 includes sections, which are groups of 3-digit categories, such as you see with 715 here with the display on the right. The categories are 3-digit code numbers. Subcategories are 4-digit code numbers. And the 5th-digit subclassifications are the 5-digit code numbers. A decimal point is used to separate the basic 3-digit category codes. Codes must be assigned to the highest specificity of the highest level of specificity, meaning if a 3-digit code category has a 4th-digit subcode category, then you must use the 4th-digit code. The same is true if the code can be expanded to a 5th digit. Many of the 5th-digit classifications will appear at the beginning of the chapter, section, or 3-digit category to which they apply. Depending on where the 5th-digit subclassification appears, will instruct the coder if the 5th-digit classification applies to the entire section, the entire chapter, or the entire 3-digit category. Usually the 5th-digit subclassification section appears in a box format. Codes in the tabular list that require more than 3 digits will have a small note next to the code stating check 4th or check 5th. Also listed under the code in brackets are the valid numerical choices for the 4th or 5th digit. A valid 4th or 5th digit may represent a range of numbers or specific numbers. For example, a range in the bracket, the first possible 4th digit is listed, then a hyphen showing the last listed digit. And you will see that under code 715.2. You will see that in the brackets we have 0 hyphen 8, meaning all of those terms or all of those subclassifications displayed in that green box are valid. For specific numerical values, then it is separated by a comma, and we see an example of that with 715.0. With 715.0, the only valid 5th digits that we can use is 0, 4, or 9. The format of the tabular list of Volume 1 is important to know. The codes appear in numerical order. Code numbers and titles appear in boldface. Instructional notes that apply to the section, category, or subcategory are included. There are also appendices as part of the tabular list, and we're showing 2 of them here for you. There's only 2 that are still in use. Appendix A on the left is the morphology of neoplasms. This appendix represents optional codes that indicate the histology, meaning tissue type, and the behavior of a neoplasm. Behavior types include malignant, benign, unspecified. Appendix C is used for classification of drugs by the American Hospital Formulary Service, list number, and their ICD9 CM equivalents. This appendix can be useful in locating a drug in the table of chemicals for coding poisonings. Many of the main terms in the alphabetical index identify diseases, conditions, or injuries. The main terms are set flush with the left margin and always are printed in bold type. Subterms indicate site, type, or etiology of conditions or injuries. Subterms are indented one standard indentation and begin with a lowercase number and are not printed or bold typed. More specific subterms are indented even further to the right as needed, always indented by one standard indentation for preceding subterms and listed in alphabetical order. Carryover lines are indented two standard indentations from the level of the preceding line. Carryover lines are used when a complete entry cannot fit on a single line. They are indented further to avoid confusion with the main term entries. As a coder, sometimes you will not always be able to locate the term in the alphabetical index. You may have to think of a synonym or an alternate term to locate that entry. For example, congenital conditions are often indexed under the main term anomaly rather than under the name of the condition. Conditions that complicate pregnancy, childbirth, or puerperium are also found under such terms as delivery, labor, pregnancy, and puerperal, or the main term for the condition causing the complication. Many of the complications of medical or surgical care are indented under the terms complications rather than under the name of the condition. And then late effects of an earlier condition can be found under late effects of. So this slide provides us an example of the main terms and the subterms. It might be helpful if you have a book to turn directly to the rabies section in the alphabetical index. But as you see here, we're trying to show you the indentations and some of the carryover lines. We actually have two subterms under rabies, which is the main term, contact and vaccination prophylactic. Contact and vaccination are considered subterms. Then under the contact, we have three subterms: exposure to, inoculation, and reaction. And if you look at reaction, it tells us to see complications, vaccination. So that becomes a more specific subterm that is also a carryover term. So it's just something for you to be aware of as you're proceeding through the alphabetical index. Here we have another example. It's imperative to understand the alphabetical rules in the alphabetical index of volume 2 and 3 in order to locate the codes. Alphabetization system rules ignore single spaces between words, such as seen on the slide in the example of bee sting. Ignores single hyphens within words, as seen by beer drinkers, heart disease, and Brailsford-Moore disease or syndrome. And it ignores the final S in possessive words of the as seen in the Brailsford's disease. This slide shows us that not everything under the alphabetical index are alphabet letters. It is possible for us to have numerical entries. So under our chromosome anomalies, we need to remember that there are anomalies specific to chromosome 13, 18, and 21. We also have issues with coagulation factors, so we have factor 7, 8, 9. Those are all identified. So it's one of those things you have to be really careful. Those are listed in numerical order rather than being alphabetized in their spelled out form. Characters and words include Roman numbers such as 2, Arabic numbers such as 2, and adjective numbers or terms such as second. Words such as with, in, due to, and associated with are used to express the relationship between the main term or subterm indicating an associated condition or etiology. This concludes Chapter 1. Please be sure to complete any associated assignments according to our course schedule. Thanks.